Neurologist warns. If your nails look like this after 60, your body may be hiding 4 diseases. Right now, at this very moment, before you embark on any other task or thought, I urge you to pause. Take a deep breath and then hold up one of your hands, turning it so that the delicate landscape of your fingernails is fully visible. Don't simply cast a quick, dismissive glance, as you might habitually do. Instead, I ask you to truly scrutinize them, to look with a newfound purpose and an attentive eye. Because in the next few minutes, I am going to reveal a profound truth, a piece of crucial health information that an astonishing majority of people over the age of 60 have regrettably never been informed about. This isn't obscure, esoteric knowledge. It's something that expert cardiologists utilize every single day in their practice, yet they seldom take the time to comprehensively explain its significance to their patients. The reality is that your fingernails, those seemingly innocuous structures at the tips of your digits, are silently and continuously recording a detailed log of the intricate activities of your heart and the vast network of your blood vessels. They have been faithfully performing this vital function throughout your entire life, from your earliest days to this very moment. And here's the critical insight. If you possess the precise knowledge of what subtle indicators to look for, these silent sentinels can provide an invaluable early warning system, alerting you to the potential onset of a severe cardiovascular crisis long before it ever manifests with overt, dramatic symptoms. I am Dr. Noah Whitaker, and for the greater part of my professional life, I have dedicated my career to the vital field of preventative cardiovascular care, specifically focusing on the unique needs of adults who are 60 years of age and beyond. Over these many years, a recurring observation within my clinic has emerged, a pattern that genuinely causes me deep concern and even frustration. Far too often, individuals arrive at my office in the aftermath of a devastating heart attack or a debilitating stroke. When I conduct a thorough and meticulous examination of these patients, I invariably discover that the crucial warning signs were already subtly etched upon their nails, sometimes for many months or even several years preceding the actual event. The tragedy lies in the fact that nobody had noticed these signs. Nobody had empowered them with the knowledge of what to look for, how to interpret these silent signals. That deeply troubling gap in awareness, that missed opportunity for early intervention, ends definitively today. I implore you to stay with me through the entirety of this discussion, because the final sign I will disclose is one that consistently leaves most people utterly astonished and deeply reflective. Before we delve any further into these revelations, I want to engage with you in a small yet profoundly important way right now. Please take a moment to type your age into the comments section below, and also share whether anyone in your immediate or extended family has ever experienced a heart attack or a stroke. Your candid response to this question will be instrumental in helping you personally gauge the urgency with which you need to absorb and act upon all the critical information we are about to cover. And if you find this kind of content to be genuinely helpful and empowering, a simple click on the like button would be greatly appreciated. It truly makes a significant difference, helping me to extend the reach of this vital information to a wider audience of people who desperately need it. To truly grasp the profound reason why your nails serve as such an invaluable repository of information about your internal health, particularly your cardiovascular well-being, it is essential to comprehend a fundamental piece of human biology. Your nails, far from being inert appendages, are living tissues that continuously grow from a specialized structure known as the nail matrix. This bustling hub of cellular activity is situated just beneath the protective skin at the very base of each nail. The cells within this matrix are in direct, unceasing contact with your bloodstream, forming an intimate connection to your body's circulatory system. They receive their essential nourishment and oxygen from the tiniest, most delicate blood vessels in your entire body, the capillaries that intricately weave their way beneath your nail bed. Because these capillaries are so incredibly minute, so remarkably fragile, they are among the very first physiological structures to register and display display signs of stress when your cardiovascular system, for any reason, begins to encounter difficulties or struggle. Consider your nails, therefore, not as mere decorative coverings, but as a sophisticated live monitor that your body has been quietly and continuously operating every single day of your existence, diligently recording vital internal data. The significance of this natural monitoring system becomes even more pronounced once you cross the threshold of 60 years of age. The fundamental reason for this heightened importance is that as we age, the body's inherent ability to compensate for early-stage cardiovascular problems becomes significantly diminished, its reserves much narrower. In your 30s, for instance, your robust heart often possesses the remarkable capacity to quietly work around minor dysfunctions or emerging issues for years on end without producing any visible external symptoms or warning signs. The body's youthful resilience effectively masks these underlying problems. However, after the age of 60, these physiological reserves are considerably thinner, less forgiving. Consequently, the subtle warning signals, those crucial indicators of distress, tend to surface much earlier, and your nails, due to their unique microvascular connections, are frequently the very first place where these vital alerts become visibly apparent. This makes diligent observation of your nails an extraordinarily powerful tool for early detection in later life. The unfortunate reality of our modern healthcare system is that a typical doctor's appointment, often constrained to a mere 15 minutes, simply cannot encompass the entirety of a patient's health landscape. Within such tight timeframes, a thorough and detailed nail examination rarely makes it onto the priority list, unless there is something overtly and visually alarming, something that immediately screams for attention. As a result, this incredibly valuable information, meticulously gathered and documented in extensive medical research, remains largely confined to academic journals and specialized clinics. It tragically fails to reach the very person who needs it most, the individual sitting at home, unaware of these silent indicators, who could potentially benefit from early intervention. That significant and potentially life-threatening gap in knowledge, the chasm between medical discovery and public awareness, is precisely what I am dedicated to closing for you today, empowering you with the insights that can truly make a difference in your long-term health. The very first sign I want to guide you through, a subtle yet profound indicator, is known as Terry's nails. This term is not commonly encountered in everyday conversation, and most people have likely never heard it before. However, once you become acquainted with its distinct characteristics, you will undoubtedly begin to observe every pair of hands you encounter with a newfound perception and understanding. Terry's nails manifest when the entire surface of the nail plate, from the cuticle to the tip, takes on an opaque whitish or a remarkably pale hue, often likened to the appearance of frosted glass. What distinguishes Terry's nails from simply pale nails is one critical, defining feature located at the very distal tip of the nail. There, you will observe a narrow, distinct strip of natural pink or reddish color, typically spanning only a few millimeters in width, separating the pale body of the nail from its very edge. This characteristic reddish band at the tip is the definitive marker that differentiates Terry's nails from an ordinary, benign paleness of the nail. Now let's explore why this particular nail characteristic holds such profound significance for the health of your heart. Extensive research, meticulously published in leading journals of cardiovascular medicine, has consistently identified Terry's nails as being significantly associated with a heightened risk of several serious medical conditions, including coronary artery disease, congestive heart failure, and diabetes. To illustrate the magnitude of this correlation, one particularly compelling study revealed that individuals presenting with Terry's nails had an odds ratio of over 6 for developing coronary artery disease when compared to individuals who did not. exhibit this nail sign. This is far from a minor statistical footnote or an academic curiosity. It represents a major, undeniable signal that warrants serious attention. Furthermore, all the medical conditions that have been clinically linked to Terry's nails share a crucial commonality. They are typically conditions that develop slowly and insidiously, often progressing silently over many years before any dramatic or acute symptoms finally compel a patient to seek medical attention. I recall a patient whom I will refer to as George, who came to see me when he was 71 years old. He presented with no dramatic complaints, reporting that he generally felt reasonably well, though he admitted to being a little more tired than usual. He, quite understandably, attributed this mild fatigue to the natural process of aging. During my routine physical examination, as I meticulously observed his hands, I immediately noticed that his nails exhibited an unusual paleness, unmistakably accompanied by that characteristic reddish strip at the very tip, a clear sign of Terry's nails. This observation prompted me to ask him some more careful and probing questions about his medical history and lifestyle, and subsequently, I ordered an echocardiogram, a specialized ultrasound of the heart. The results of this test were eye-opening. They revealed early-stage heart failure, a condition that had been silently developing for close to 2 years without any obvious or alarming symptoms that George would have recognized. Thanks to the early warning provided by his nails, George received the correct diagnosis and the appropriate treatment at precisely the right time. Today, I am pleased to report George is doing exceptionally well. His nails were not just a cosmetic feature, they were the crucial doorway that opened a vital conversation, leading to a life-saving intervention. The second distinctive sign we must discuss is known as Lindsay's nails, sometimes more descriptively referred to as half-and-half nails due to their very particular and unmistakable appearance. Once you are aware of what to look for, you will recognize this pattern immediately. Lindsay's nails are characterized by a striking division of the nail plate into 2 distinct and visually separate zones. The half of the nail closest to your cuticle, the proximal portion, appears distinctly white or very pale, lacking its normal healthy pinkish hue. Conversely, the half of the nail closest to the very tip, the distal portion, takes on a noticeable brownish-red color. The boundary or dividing line between these 2 contrasting zones is typically quite sharp, clear, and well-defined, making this sign unmistakable. Clinical research has consistently associated Lindsay's nails with significant underlying health issues, specifically heart failure and liver cirrhosis. This particular nail pattern tends to emerge after the body has been subjected to sustained and prolonged circulatory stress for a considerable period, reflecting a systemic burden. The reason I have chosen to highlight both Terry's nails and Lindsay's nails early in our conversation is that both are fundamentally disorders of nail bed color. They serve as direct visual reflections of how effectively blood is actually reaching and adequately nourishing the tiniest tissues throughout your body, particularly in the extremities. When the microcirculation to the fingertips is compromised or impaired over a sustained duration, the delicate nail bed loses its normal, healthy pinkish color and in its place begins to display these altered and abnormal patterns. The remarkable aspect of both these signs is their accessibility. They are plainly visible in ordinary daylight, requiring no special equipment or advanced medical tools for detection. If you were to hold your hand under good natural light right now and meticulously examine each nail, you could diligently check for both Terry's nails and Lindsay's nails in under 30 seconds. I encourage you to do so right now while these detailed descriptions are still fresh and vivid in your mind to immediately apply this newfound knowledge. The third significant sign we need to understand is something called Muirche's lines. These are multiple, delicate, horizontal white lines that traverse the nail plate, running perfectly parallel to the lunula, which is that small, characteristic crescent-shaped area at the very base of your nail. A crucial detail that helps differentiate Muirche's lines from other types of nail anomalies is their tactile quality. When you gently run your fingertip over them, they do not feel raised. You can perceive them clearly with your eyes, but you cannot detect them by touch. They are purely a visual signal, not a textural one. What elevates the significance of Mangez's lines, making them particularly compelling, is the robust body of research underpinning their clinical importance. A comprehensive study specifically designed to examine the intricate relationship between various nail findings and the presence of cardiovascular disease concluded that Mangez's lines were a statistically significant predictor of heart failure, exhibiting an odds ratio approaching 6. This potent statistic means that the presence of these distinctive lines on a patient's nails made the diagnosis of heart failure substantially more likely. The underlying physiological reason for this connection is that Mangez's lines are believed to reflect low albumin levels in the blood. Albumin is a critical protein produced by the liver, essential for maintaining fluid balance and transporting various substances in the bloodstream. Low albumin levels, in turn, are a well-established marker indicating that the body is under prolonged nutritional and circulatory stress. When the heart is struggling to circulate blood efficiently throughout the vast network of vessels, the entire body, including the nail matrix, begins to feel the profound effects of this systemic inefficiency. I recall a patient named Margaret who first consulted me at the age of 68. She maintained an active lifestyle, was not overweight, and genuinely felt that her health was excellent. During our conversation, almost as an afterthought, she casually mentioned that she had noticed some faint horizontal lines on her nails over the past few months. She had dismissed them, figuring they were probably just a normal sign of aging. I looked carefully, and recognizing the unmistakable pattern of Mangez's lines across several of her fingers, I immediately ordered a comprehensive cardiovascular workup. To our surprise, we discovered early-stage heart failure, which critically was entirely manageable because it was caught at such an initial stage. Those subtle lines had been appearing for months, a silent plea from her body, quietly asking for help that no one had yet understood how to read. The fourth vital sign, known as Bow's lines, tells a remarkably different story compared to the chronic, gradually developing conditions reflected by the other nail changes we have discussed. While most nail signs tend to build up insidiously over time, mirroring chronic physiological processes, Bow's lines emerge distinctively after a specific, significant event. They manifest as deep, horizontal grooves or indentations that run across the nail plate, perpendicular to its direction of growth. The physiological basis for their appearance is straightforward yet profound. When the body endures a significant physiological shock or major health crisis, whether it be a severe heart attack, a complex cardiac surgery, a debilitating systemic infection, or any other profound health challenge, the sensitive nail matrix, the very engine of nail growth, briefly and temporarily ceases its production of new nail tissue. When normal nail growth eventually resumes, this period of suspended activity leaves a distinct, indelible groove or depression behind in the nail plate as it continues to grow out. What makes Bow's lines clinically important, indeed indispensable, is their unique capacity to reveal a past cardiac event that the patient themselves may not have even recognized or remembered. It is a sobering fact that silent heart attacks are considerably more common than most people realize, particularly among older adults who may attribute chest discomfort or breathlessness to other, less serious causes. I recall a patient named Harold who came to see me for something entirely unrelated to cardiovascular health. During his examination, my eye was drawn to a clear, horizontal groove extending across nearly all of his fingernails. I inquired about it, and after a moment of thoughtful reflection, Harold recalled being very seriously ill about 4 months prior with what he had initially assumed was an unusually severe bout of the flu. We proceeded to run some diagnostic tests, and to both our surprise and his profound relief, we discovered that he had, in fact, experienced a silent heart attack during that illness. His boslines had, without a single spoken word, unequivocally told the story that his own symptoms had failed to convey. Now, I want to pivot our attention to a type of indicator that you can check directly underneath the nail surface rather than on top of it. These are known as splinter hemorrhages. As their name vividly suggests, they appear as tiny, dark splinters or thin, dark lines running vertically along the length of the nail bed. They are, in fact, small collections of blood that have leaked from damaged capillaries and become trapped within the delicate tissues of the nail bed. While discovering a single splinter hemorrhage might be attributed to a minor trauma, such as bumping your hand against something, and is typically nothing to be unduly concerned about, the presence of multiple unexplained splinter hemorrhages appearing across several fingers is an entirely different and far more serious matter. In classic medical training, the appearance of unexplained splinter hemorrhages across multiple nails is strongly and consistently associated with infective endocarditis. This is a severe and potentially life-threatening infection of the inner lining of the heart's chambers and valves. This dangerous condition typically develops when bacteria, which may have entered the bloodstream from various sources, attach themselves to previously damaged heart tissue. Once established, the infection can cause tiny infected clots, known as emboli, to break off from the heart valves. These emboli then travel through the bloodstream to distant blood vessels, including the extremely tiny ones nestled within your nail bed, where they can cause these characteristic hemorrhages. Infective endocarditis is an acute and serious condition that mandates immediate and urgent medical attention, as delays in treatment can have catastrophic consequences. I remember a patient named Phyllis who, almost as a fleeting afterthought during a routine checkup, mentioned that she had noticed these peculiar dark lines on several of her nails. Thanks to her casual mention and my immediate recognition of the potential significance, she was promptly diagnosed with a heart valve infection. Crucially, it was caught in time to be treated effectively, saving her from what could have been a much more severe outcome. She later confided in me that she had almost not mentioned the lines at all, dismissing them as insignificant. Her story powerfully underscores the critical importance of speaking up about even the smallest, seemingly trivial observations. If this video has proven useful and enlightening to you so far, I earnestly ask you to take one simple action right now before we proceed further. Please hit the like button. It takes merely 1 second of your time, yet it genuinely makes a significant difference in ensuring that this vital content reaches others who are in dire need of this information. And please, remain with me, because the next 2 signs we are about to cover are the ones I want you to regard with the utmost seriousness and attention. The small, distinctive, whitish crescent shape prominently visible at the base of each of your nails is known as the lunula. Most people tend to view it simply as a cosmetic feature, an aesthetic detail of their fingernails. However, the lunula is, in fact, far more than that. It is the visible portion of your nail matrix, the highly active and dynamic zone where new nail cells are continuously being formed around the clock. And here's the critical insight. The color of your lunula is, astonishingly, one of the most overlooked and undervalued diagnostic signals on the entire human body. When that color undergoes any noticeable change, it is absolutely worth paying very close attention. Extensive research has meticulously documented that a reddish lunula is significantly associated with serious underlying conditions, such as valvular heart disease and congestive heart failure. This coloration suggests a change in the microvascular environment or systemic circulatory stress. Similarly, a bluish or purplish lunula serves as a potent indicator, strongly suggesting problems with oxygen delivery within the circulation. This is analogous to the generalized cyanosis we observe in more advanced stages of cardiovascular disease, where tissues are deprived of adequate oxygen. Furthermore, a lunula that has progressively faded to almost nothing, becoming extremely pale or virtually disappearing, is frequently a telltale sign of anemia. Anemia, a condition characterized by a reduced number of healthy red blood cells or a lower than normal amount of hemoglobin, is directly and profoundly connected to cardiovascular strain. An anemic heart is compelled to work significantly harder, pumping with increased effort and frequency to compensate for the diminished oxygen carrying capacity in the blood, thereby placing undue stress on the entire cardiovascular system. All three of these observed color changes in the lunula warrant immediate medical attention and a thorough investigation. I vividly recall the case of Dorothy, a 74-year-old patient who contacted me after her daughter, a registered nurse, noticed a disturbing change during a routine visit. Her daughter observed that the characteristic half-moon shapes, the lunulae, on Dorothy's nails had almost entirely disappeared. Dorothy herself had not noticed this slow and gradual transformation because it had been unfolding so imperceptibly over time. She had been looking at her nails every single day, naturally adjusting to what became her new normal without realizing that anything significant had actually shifted. Her observant daughter, understanding the implications, strongly encouraged her to bring this observation to her next appointment. We conducted a complete blood count and a comprehensive cardiovascular workup. The results confirmed that Dorothy was significantly anemic and was indeed showing early signs of cardiovascular strain. Both issues were fortunately caught and effectively treated before anything more serious could develop, all thanks to the subtle disappearance of her lunulae and her daughter's keen eye. Now, let me empower you with a simple yet remarkably effective test that you can perform on yourself right now using nothing more than your own hands. This crucial diagnostic maneuver is called the capillary refill test, and it directly measures how quickly your smallest, most delicate blood vessels recover and reperfuse after being subjected to brief pressure. Here's precisely how you do it. First, hold your hand comfortably at the level of your heart. Using the thumb of your opposite hand, press firmly on one of your fingernails for approximately 2 seconds. As you apply this pressure, you will observe the nail bed beneath going pale or white, a clear indication that the blood has been temporarily pushed out of the capillaries. Then release the pressure and immediately begin counting quietly in your head. 1 Mississippi, 2 Mississippi, 3 Mississippi, and so on. In a healthy adult with robust circulation, the vibrant pink color should return to the nail bed in less than 2 seconds. If, however, it takes 3 seconds or longer for the color to return, and you consistently obtain the same slow result when you test 3 or 4 different fingers, then this is a highly meaningful and concerning sign. It indicates that your microvascular circulation, the flow of blood through your tiniest vessels, is sluggish and potentially compromised. Extensive medical research has consistently linked persistent, slow capillary refill in older adults to several serious underlying conditions, including reduced cardiac output, meaning your heart isn't pumping blood as effectively as it should, undiagnosed atrial fibrillation, a common and dangerous heart rhythm disorder, and an elevated risk of stroke. I urge you to try this simple yet powerful test right now before you finish watching this video. For the most accurate results, ensure you perform it in a warm room and with warm hands, as cold temperatures can constrict blood vessels and artificially distort the outcome. I vividly recall a patient named Walter who, one evening, decided to try this test after learning about it. He counted nearly 5 seconds before the natural color returned to his index finger. Concerned, he tested his thumb next, then his middle finger, and subsequently the fingers on his other hand. Each time, he observed the same alarmingly slow result. The very next morning, he promptly called my office and meticulously described exactly what he had observed. A full diagnostic workup was initiated, which subsequently revealed undiagnosed atrial fibrillation, AFib. AFib is an irregular and often rapid heart rate that can lead to blood clots in the heart, significantly increasing the risk of stroke. And it is, tragically, one of the most common and dangerous causes of stroke in adults over 60. Walter was immediately placed on appropriate treatment, and based on everything we currently understand from the most up-to-date cardiology literature, that proactive phone call, prompted by his observation of his nails, very likely prevented a major debilitating stroke within the following year. What makes Walter's story so profoundly impactful is that at the time of his self-test, he had absolutely no other noticeable symptoms of atrial fibrillation. This simple capillary refill test was his only warning. Now let me provide you with a clear, practical framework for how to integrate all of this powerful knowledge into your daily life. I want you to start today. Not next week, not at your next scheduled appointment, but right now. Take both of your hands to a window where there is good, natural daylight. This is crucial for accurate color perception. Look at each nail, one at a time, meticulously. First, check the color of your nail bed for any bluish, purplish, or any other unusual paleness that deviates from its healthy pink. Next, examine the very tip of each nail for that characteristic reddish band, which is the hallmark signal of Terry's nails. Then, look closely for any multiple horizontal white lines that traverse the nail, lines that you can clearly see but cannot feel with your fingertip. These are Muirca's lines. Also, check for any deeper horizontal grooves or depressions that might be Bow's lines, indicating a past physiological stressor. Scrutinize beneath the nail surface for any tiny, dark, vertical lines that resemble splinters, appearing without any preceding trauma. These are splinter hemorrhages. Finally, examine the base of each nail for the lunula, that delicate, crescent shape, and pay close attention to its color and its size. After this visual inspection, proceed to perform the capillary refill test on at least 3 different fingers and count the seconds honestly and accurately. It is absolutely vital that you write down what you find. This documentation step matters far more than most people realize because these subtle changes are often slow and gradual, and human memory is notoriously unreliable when it comes to recalling such nuanced shifts over months and years. A photograph of your hands, taken today in good natural light, provides you with something concrete, objective, and honest to compare against 6 months from now, creating a personal health baseline. If you observe just one of these significant signs, mention it to your doctor at your next routine appointment. However, if you detect 2 or more of these signs together, do not, under any circumstances, wait for your annual checkup. Call your doctor's office this week. Describe precisely what you have observed on your nails and explicitly ask whether you need to be evaluated sooner rather than later. One final, incredibly important caveat before I conclude. Please do not use any of this information to diagnose yourself. What these signs are designed to do is empower you, giving you a specific, informed, and articulate reason to initiate a productive conversation with your doctor. An accurate diagnosis always emerges from the full clinical picture, your complete medical history, your current medications, any other symptoms you might be experiencing, and a thorough professional evaluation. Your primary role in this process is not to diagnose. Your crucial job is to notice, to meticulously document, and most importantly, to speak up. That crucial, proactive step is the part most people tragically neglect. And yet, it is the part that makes all the difference in potentially life-saving early detection. Your nails have been silently sitting at the very end of your fingers your entire life. They have been diligently taking notes every single day, faithfully recording how your blood is moving, how efficiently your heart is working, and what your smallest, most vital blood vessels are doing. The only thing that was missing was someone to tell you how to correctly read and interpret the incredible data they were constantly recording. You now possess that invaluable knowledge. Use it wisely. Please share this video with someone you love, someone whose health and well-being you cherish, because the next person who watches this might just be the individual who spots something critical on their own hands tonight, and by making that vital call to their doctor, makes a decision that ultimately saves their life. I will see you in the next empowering discussion.